Good day, folks. Alfie Venta here once again at Venta Pain Relief Clinic and VPRC.ca. I'm hoping you're having an amazing day. Today we're going to talk about deep tissue massage for runners. 5 common running injuries and presentations. This is basically more from a soft tissue perspective, muscles and fascia. So we're going to discuss these common injuries. Um, so, first of all, why deep tissue massage? So I have a number of points there. The aggressive downward and forward pressure provides a greater stretch. Athletes' muscles tend to be more developed, and accessing deeper structures with lighter treatments can have less of an impact on these structures. For the most part, many of our patients are very athletic. They do a lot of running, triathlons. They do a lot of work in the weight room, and they tend to have very, very, very thick muscles. And to access those tissues that are deeper in, you need to provide enough pressure to access those structures. It seems to also provide longer-term positive outcomes. So this is more from over the years, my observations and feedback from different patients, and that like over 25 years of doing this, there seems to be a longer term in regards to how a patient feels from the deep tissue muscle work. Just gonna move myself over here for a second. So, the first injury we're going to talk about is heel pain, a very common one for runners. Many of you may have heard of plantar fasciitis. It's basically an issue with a tissue called the plantar fascia, which lies at the heel and runs into your toes. So it's kind of like a tendinous tissue. It can become inflamed and painful around the heel. So it's an annoying injury that can actually last from a few months to sometimes over a year. What people will find is that when this issue occurs, over time, and when it becomes worse, it hurts a lot more in the morning when they get up and then they put their foot down. And a lot of times it's because of like the tissues becoming cold overnight. The tissues become more rigid. You stand up and then all of a sudden the pain ensues. A soft tissue reason for heel pain are trigger points. So trigger points are taut bands in a muscle, and they can cause issues not only locally but further away from the area. So some examples here of trigger points that can cause heel pain include the calf muscles, the gastrocnemius, and the tibialis posterior. The gastrocnemius is the most superficial calf muscle. Is very powerful, and if you get trigger points there, it can refer into the calf and also into the back of the knee. The tibialis posterior is more of a deeper calf muscle, and it attaches to the inside, the medial arch, the arch that's on the inside of your foot. And this muscle, when it's very, very tight, it can cause a potential referral down into the inside of the heel. And finally, piriformis. This is higher up. It's a deep muscle in the glute. So if you've ever had piriformis syndrome or piriformis tightness, you'll understand how painful this can be. The piriformis, when it has trigger points, it can refer into the thigh, the back of the thigh, the calves, and into the heel. IT band tightness. Over here, this is a picture of the IT band. It's another common one another common structure to become very tight on runners. And it usually happens when runners are running on uneven surfaces. Sometimes what happens is like you could be pushing off more with one leg, and then all of a sudden two muscles can become tight, and what it does is it actually causes more tension on the IT band, that thick tendinous tissue that runs from your glute all the way down the side of your thigh to just below your knee on the outside there. So gluteus maximus and tensor fascia lata. These muscles blend into the IT band The gluteus maximus, it runs from the back here. Here's the side view right there. So this is the glute maximus. It blends into the IT band. The tensor fascia lata is actually more towards the front and the lateral side of the thigh. And that too blends into the IT band. So you got one muscle from the back side, one muscle at the front side, and they're pulling on the IT band. When it becomes very tight, it can cause pain in the hip, lower back, thigh, and into the knee. Okay, so this isn't really an injury per se. I call this posterior chain tightness, and a lot of you can relate to this kind of issue, and not necessarily runners. This could be somebody who's not active, but they're finding a lot of tightness with the structures on the posterior side of their body. So, for example, the calves, their hamstrings, their glutes, lower back, upper back, mid back. Back of the neck. Those structures are on the posterior chain. These muscles and fascia in those areas can become super tight, and it requires deep muscle work, aggressive work into those structures, particularly if you are a person that's been training hard and your muscles are fairly thick or fairly or very tight just from training itself. The fascia can also become tight, particularly around the calves, lower back, and also at times the glutes can become very tight also. So this is posterior chain tightness. It's a very simple treatment relative to the other ones that I've talked about, because generally I just go in there with my knuckles, elbows, and forearms, and I dig into those structures to get the structures to relax. So hip flexor tightness. Another one that is very common, not only for runners, but for people that have like with the gym. The most common muscle, the most common hip flexor muscle to be implicated in these kind of issues is the iliopsoas. And I know that many of you guys have done yoga, Pilates. I'm sure your instructors have talked about this particular muscle. This muscle, when tight, can cause lower back, hip, and upper inner thigh pain. With the iliopsoas, it requires a bit of depth to go into the structure, because it lies basically right behind the abdominal contents. And I'm not necessarily going in to actually treat the iliopsoas per se directly. I've got to work through the structures that are in front of it to access these tissues. But once the hip flexor, the iliopsoas, is relaxed, the person feels better with the lower back, their hips, upper and inner thigh also. And finally, we have knee pain. Just going to move myself again. So when we talk about knee pain, again, the theme is from a soft tissue perspective, so muscles and fascia. So the first one is trigger points from quadriceps muscles, adductor muscles, gastrocnemius, and hamstrings. So these trigger points, the quadriceps and the adductor, they basically can refer into the knee. With the gastrocnemius and hamstrings, it's kind of like more the back of the knee that can refer trigger points into. So basically with these muscles that become very tight with trigger points, I dig into the quadriceps, I dig into the adductors, gastrocs, and hamstrings, and I try to get those muscles to relax. I stretch it out, again using my knuckles, elbows, forearms, whatever is needed to get that muscle to stretch out. The middle one there, patellar tracking problems. So if you have issues with knee pain because of a tracking issue, what that basically means is that the kneecap, it glides in this groove in your upper in your thigh bone, lower down, and basically it has to sit in a particular position as you're extending the knee. And in order for that to happen, you got to have muscles that will pull it so that it stays within that patellar groove, that groove, the trochlear groove. And if one side is tighter than the other, what will happen is that when you extend your knee, that patella, your kneecap, will be off track, potentially causing pain in the knee. And generally what will happen is that, here I'm going to point, this muscle here, vastus medialis, tends to be weaker. And then the outside here, the vastus lateralis, all the other structures on the outside of the thigh there, are a lot stronger. And because of that, it'll pull the kneecap towards the outside, potentially causing pain. And what I need to do as a therapist is basically loosen up the tissues on the outside and work on trigger points in vastus medialis to decrease the pain. Along with the massage and the deep tissue work, the person's given exercises to help them to strengthen those weaknesses and stretch out the problematic areas. And finally, in regards to knee pain, the IT band tightness that we talked about earlier, and from a soft tissue perspective, again with the IT band, you have the gluteus maximus and the tensor fasciae lata. Both of them blend into the IT band, and if they're very, very tight, it can pull on the IT band, causing pain more on the outside of the knee. So those are some reasons for knee pain relative to the soft tissues, the muscles and the fascia. Thanks for watching. We really appreciate it. Please like, share, subscribe, and pass this on to those that you feel that this might be helpful for. We want to thank you in advance. Again, follow us on our social media. If you've got any questions, please feel free to give us a call at 416-644-8894. That's our clinic number in downtown Toronto, Financial District, King and Bay at First Canadian Place in Toronto. You can also email us at admin@ventepainrelief.com. Once again, my name is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. I hope you have a great day, and we will see you in the next video. Take care.